Let's talk a little bit about cranial work. I feel cranial work is so helpful in so many cases, especially headaches, sinus problems. I can actually help people with sinus infections. A lot of times their whole head gets clogged up, and the cranial work helps get the sinuses and everything moving and pumping like it's supposed to be, and it'll really help clear up a sinus infection very quickly. Sometimes people even get like their ears filled up, they can't really hear. That is usually caused by the proper drainage is not happening out of the head, because usually with those you have a really bad subluxated atlas. At the same time you have the cranial problems that are all stopping everything from draining correctly. So I'm going to show you a few tricks that you can use with cranials. Now, I know traditional cranial work is very light touch, and they spend a lot of time, including hours, sitting and waiting for pulses. And I really, in my practice, in reality, in real life, I really don't have the time to do that kind of cranial work where I'm actually feeling for pulses and everything. So I guess what I really do is impose my will on the skull. I actually just decide what needs to be done and actually do some work to accomplish that. So I'm going to show you a few little tricks that I use to give what I call a chiropractic cranial. And it's a very shortcut kind of cranial, and it actually will do some pretty amazing stuff. So I'm going to hope that you try it. Chiropractic cranial work. One of the first things I like to do when I'm doing cranial work, I usually glove, and I always I start with the inside of the mouth. I do a little bit of intraoral work at first, and this is when I would usually set the jaw. So I'm going to show you a little bit of jaw work for TMJ. But the first thing I do is check to see how fixed the skull is. So I do a little pumping on the upper palate where the sutures come together on the upper palate. I contact with my finger right on that, and I do a little bit of work on that. So open your mouth. I go right up here with my finger, and I'm going to just kind of push up and do a little pumping motion. You can usually get a feel for how fixated the skull is by how much movement you have. You should have a little bit of movement when you do this. You should feel just a little bit of movement under your hand. So this is a really good way to kind of assess it, and it also is a good pumping motion. It's really good on children and babies because it pumps the skull a little bit. It pumps all the cerebral spinal fluid around. I usually put the flat board underneath when I start on a cranial, so I lay them on the board so that it kind of gives me a flat surface to work from. I have the table down and I keep it kind of flat, so that gives me a flat surface to work from, so that gives me a little bit more of an idea what's going on. When I'm contacting on this move here, my contact on the inside of the skull, you can see right here where the sutures come together on the palate. That's what I'm contacting when I'm doing that. Sometimes you'll feel people have a big bump kind of hanging down there. That's a tori, a dental tori. And it's nothing pathological or anything. It's just a normal variation for people. Some people are nice and flat like this, and some people have the little dental tories coming down on the top. So what you do is you actually do a little pumping right here. This is what I'm doing when I'm on the inside of the skull here. I'm pumping this like this on there. The next move is the sinus move, and the sinus move is to kind of open up the maxilla. A lot of times that maxilla gets kind of compressed. So what I do is I'm going to actually lift up on this suture right here above the nose. I'm going to lift up the forehead, the frontal section, and I'm going to take this on, put my fingers on either side of the maxilla, the top of the maxilla, and I'm actually going to rotate up like this. This is what I'm going to be doing with her. So that's going to help clear the sinuses. And you'll be shocked how fast this clears up people's sinuses. They can breathe better immediately as soon as you do it. Okay, so what I'm going to do here is I'm going to catch her at the bottom of the frontal section like I showed you, and I'm going to go into here, under her back of her teeth. Was that your jaw? Mm-hmm. Oh my gosh. I'm going to go on the back of her teeth here, and then I'm going to put my two fingers on either side of the nose, and we're going to roll that maxilla up while I lift the frontal section off. So I'm lifting the frontal section and rolling the maxilla like this. Wow, it's moving too. I can feel it. Okay. So that usually, if somebody's got a stuffy nose, that'll actually clear it up immediately right there on the spot. And then with the jaw, I actually go in on the side and I do a little trigger point. So I actually relax the muscles, and hers are really tight on this side. I think her jaw is misaligned. I heard it pop just a minute ago, so I know it is. I'm doing a little cross fiber on the muscles on the side, and I'm doing a little trigger point on them, so it kind of helps release them so that you can actually move the jaw around a little better, like this. So we're going to go this, and I'm going to just do this for a little while until I feel like they're kind of giving and relaxing a little bit. And you go and do that on both sides. I'll do that on the other side too. I find that I can see what the jaw is doing, how it's tracking when I look at it upside down better than when I look at it straight on. So what I usually do is go to the top of the person's head here and ask them to open their mouth so I can see how the jaw is tracking. And her jaw is actually tracking a little bit over to the right. So go ahead and let your back. So when I go to adjust it, when I go to put it in, I'm going to take a good hold on it. I'm going to put my hand on the surface of the teeth here, on the bottom teeth, my thumbs along the surface of the bottom teeth, and I'm going to grab underneath the angle of the jaw here, and that gives me a really good grip. And then I'm going to actually turn the jaw and put it into place. I'm going to correct it. Whatever I found, I'm going to do just the opposite so I can correct that jaw. And you want to roll that jaw back into place, and you have them kind of relax as you're doing it so they can let the muscles relax so that you can actually get the jaw in. Like that. That just popped. Okay. Okay, now let me see it open again. Oh, that's better. It's more straight.
I feel the difference too.
Yeah, you can. You can feel the difference because it opens more. You have more width, like you can bite into a sandwich better, which we're going to be doing. Okay, so with that's pretty much the jaw. Sometimes the jaw will actually subluxate sideways, so sometimes you might have to push it this way or this way, depending. And sometimes dental injuries, when they've had their mouth open for a long time, it'll subluxate lateral. So be sure to check that component. And the jaw also, some people are jetters, where they jet their jaw out like that when they're tense or upset. They'll do that. So they'll actually subluxate their jaw forward. And in those cases, I take the jaw and cradle it in my hand like this, and I just push it back down into place where it's supposed to be, like that. And that'll relieve some of that problem. Now I'm going to do the rest of this. It's going to be seated. I usually do what they call like a little stabilizing move, where you actually kind of pull and traction the muscles. You can find a still point where you actually keep your hands right under here, under the occiput, the external occipital protuberance, the EOP, and that'll help stabilize and set your cranial work. When I have a person that has a cranial problem, I usually go around all the sutures. I take the coronal and I separate them apart like this, just like kind of a little Ziploc bag. I'm just kind of pushing them apart, and the body will actually help to rearrange them in the correct position when you're done. So really I'm just opening up all the sutures as I go. I'm going on the coronal right now like this. I'm separating as I go. See how I'm pushing my fingers apart? If I have a sphenoid problem, I'll actually spread it apart like this in each direction, and that'll help kind of free up the sphenoid. Then I go on the parietal, and when you do the parietal, you want to use your thumbs and pull the parietal apart, and you can actually take it and lift the parietal sections a little bit when you're working on them. So when I go down the middle, I'll go down the middle on the suture here, on the sagittal suture, and then I'll take the parietal section and I'll lift up as I do. And I feel like it kind of gives you a little bit more of a freedom in the cranial vault. Like this. We're going to cross my thumbs across and lift as I go, like this. The temporals. The temporals will kind of flip around sometimes. Usually there's just a little movement that you use to do the temporals, where you just kind of go like this. You put your hands like right in the ear canal right here, not into it, but on the flat on the outside of it. And you can just push down like this. And that sort of helps the temporals. There's a really good one where you take a good kind of a grip on the ear, the external pinna of the ear, and just pull apart like this, and it kind of helps the membranes inside the cranium to stretch and not be crimped up. When I have a sinus problem, the movement I like to use is I hold the frontal section here, I stabilize it, and then I push down on the sinus area here and actually open it up just a little more, like that. You can see I'm pushing and kind of tractioning that sinus, that frontal section off of the maxilla. Then the last way for sinuses is you can actually go on each side of the nose and kind of squeeze it in like this, kind of push it together. So those are my main moves for the cranial work, and it's very simple, and you can see it doesn't take a long time, and usually you'll get a lot of good effects from doing this. So I would suggest that, especially if you have somebody that has a cranial sinus problem, allergies, sinus stuffiness, it's really a great method of helping to relieve that problem.